Hello, my name is Alejandra. I'm a physician assistant student with the University of Pittsburgh, and I'll be demonstrating a running subcuticular stitch. The indications for this are a well-approximated clean wound with minimal tension, also better for cosmesis, or to well approximate a deeper wound with more tension just by doing the deep stitches first before finishing with the top. Contraindications of this would be a contaminated wound, as that can trap infection in there, or a wound with very high tension. Potential complications are a seroma or hematoma forming, or a potential infection if you close a contaminated wound or you don't use sterile technique. What you'll need for this are forceps with teeth, suture cutting scissors, and needle driver. You'll also need sterile sutures, so especially when you need dissolvable sutures like PGA, PGCL. You'll need a fenestrated drape that's sterile. Okay, so coming over. Patient here, I'll clean with iodine to sterilize the area, inject lidocaine with epinephrine to anesthetize. Then I will wash my hands, don sterile gloves, and drape the sterile fenestrated drape. You'll need the dissolvable sutures. I'm using polyester for this example. I've already opened the suture material just for the purposes of salvaging my material. I'm going to reuse it, but again, it should be sterile. Okay, and then you'll want to start here in the subcuticular space, doing the first throw, keeping in mind where your suture falls and staying sterile. The other side, you want to go the opposite side, matching the depth. Okay, now for this first knot, I'll do 2 loops. 1, 1, 1, and then you'll cut this part of the tail here all the way down to the knot. Pretending this is all sterile. A larger sterile field, so if that happens, you don't break sterility. Now I'm going to bury this knot. Okay. And then this last one will be for my knot. So leaving a bit of a tail here. 1, 2. Opposite way. And then one more. And then you'll cut this part of the tail again down to the knot. And then I'll want to bury my knot again. Okay, and then you'll cut this part all the way down. All right, and then I'll remove the fenestrated drape, clean the iodine off the patient with Vaseline on top and a pressure dressing, and then you'll also want to dispose of your sharps in the sharps container.